guys out there too. So we have about 10 minutes left, so I want to dive into a little myth versus fact. So this is something that I debuted on the show many months ago, but I really like trying to clear the air. Okay, we're talking about building trust and delivering truth. And so here's what I do. I say a statement and I ask the panel, and they say myth or fact. It's going to be kind of rapid fire. Maybe a few sentences on like why it's a myth or a fact, and we'll go from there. So here we go. Dr. Lome, you're sitting to my right. You get the first statement. I shouldn't call it a question. First statement. Here we go. Myths versus facts. Ideal cardiovascular health in men. Here we go. So here's the statement. I'm getting older, so symptoms like fatigue and shortness of breath are normal.
Absolutely not. Again, when you look at these blue zones, they're active, they're vital. I mean, they're working in the field, so they're 90 or 100 years old, and they're doing all the right things. We have considered it to be a normal thing in our culture because everybody is that way, because they don't eat clean, they don't take care of their lifestyle. So it is a normal thing to be tired and not be able to do much as you get older, but that doesn't mean it has to be normal. That is not the normal state of the human body. It's common. The average person who's older feels that way, but it's not the way it should be. So I call that a myth.
All right, thank you. Dr. Macaluso, here we go. Myth or fact? Here's a statement. Heart failure is the same as a heart attack.
That's a myth. A heart attack can be the cause of heart failure down the road. Anyone who has a heart attack is at risk for developing heart failure. Anybody who has coronary disease, high blood pressure, diabetes, is overweight, they are at risk for having heart failure. But it's not the same thing. Heart attack, damage to the heart muscle can lead to heart failure.
Excellent. Here we go. Next one, myth versus fact. Dr. Lome, here we go. Here's a statement. Diabetes won't affect my heart if I take my medicine.
Complete myth. So control of diabetes, control of blood sugars, has not been shown to reduce cardiovascular risk. And even in most studies, overall mortality. It can affect, taking the medicines, controlling your blood sugars can lower your risk of eye problems, kidney problems, nerve problems, but not necessarily cardiovascular health. So there's a difference between what we call macrovascular complications versus microvascular. The microvascular complications, the risk can be lowered by controlling sugars. Macrovascular, big arteries like heart and brain, no. And to sneak this one in there, man, this is the men's health thing. So when you think about overall artery function, one of the first symptoms of cardiovascular disease in men frequently is erectile dysfunction, right? 50% of men age 50, 60% of men age 60, 70% of men age 70. It's a canary in the coal mine, the first sign that you're having cardiovascular disease, right? And so anybody who's experiencing that, they got to be worried about their heart. It's a big deal because the arteries of the penis are small. They get affected before the arteries of the heart and the brain. And so there's an awesome documentary coming out called The Game Changers. I don't know if you heard this one. Everybody should watch Forks Over Knives and What the Health, no question. They're available on Netflix and YouTube. But this one called The Game Changers, showing Arnold Schwarzenegger eating plant-based, all these athletes and stuff. But they take 3 young college football players, and they have them eat a beef meal one night and a bean meal the next night. And when they ate the beef meal, one meal, they had a marked decrease in their erections. Because when they had the bean meal, at nighttime, they had a 400% increase in erections and an 8% increase in the circumference of the penis from one meal, affecting your overall artery function. It is crazy.
That is nuts.
And this
literally
nuts. Yeah, literally. And this study was actually moderated by the one of the top urologists in the country. And so it was a phenomenal little takeaway point that men, hey, you're not just talking about heart and brain, you're talking about your manly, your livelihood. So, people say, well, eating meat is masculine. Well, dude, it's not a manly thing to eat meat if it's going to be affecting you down there.
You hit the head on there. Yeah. I actually make my guys that have erectile dysfunction, I actually say, we got to check your heart before we can even talk about trying to do something. So we got to do that, but that's too funny.
Yeah.
All right.
That's
that's great. That's a great thing. I allow that one because that's talk to guys. I mean, we're talking to guys, and guys will care about that. You think about something that will affect them in the bedroom, and that can be now you get their attention. All right, here we go. Dr. Macaluso, myth versus fact. Here we go. I'm going to try to see if I can give you something a little different. Here we go. I like this one. Here we go. Once heart disease is confirmed in men, early treatment is essential to preventing end-organ damage.
Well, I think that's true.
All right,
Once you have the disease, like you said, you have to be aggressive then subsequently about treating it. And it's funny, like we have people who come in for back pain and will have like a CT scan and they have coronary calcium and it's unrecognized. And people are running around treating their back pain and they're not on cholesterol lowering, blood pressure or anything. So the point is that if you identify a disease process, you have to treat even more aggressively than you would normally in someone just looking at prevention.
All right, here we go. We'll do a couple quick more. Here you go, Dr. Lome. Here's a statement. Heart disease runs in my family, so there's nothing I can do to prevent it.
Myth. So
You like how I'm giving you all the myths, by the way.
You got it. So when you really look at the stats, what percentage of heart disease is completely genetic, meaning there's nothing you can do about it? Really, the experts say it's under 1%. It's a small amount. Again, genes load the gun, diet and lifestyle pulls the trigger. Even if you have cardiovascular disease in your family, if you eat plant-based, they have to stay thin and protect the endothelium, the lining of your arteries by not smoking and not being exposed to secondhand smoke and other things like that. You don't have to follow in the footsteps of your family. So complete and total myth.
All right, and here's the last one for Dr. Macaluso. Last myth versus fact. Here we go. Here's a statement. Heart disease in men only happens to older individuals.
Absolutely false. Sadly, we see many young people affected with it, and it's why it's so important to be seen by your physician at an early age. As soon as you hit after pediatrics, you get an adult doctor.
Yeah, you hit that on the nail. Thank you. So here we go, guys. We got about 5 minutes.